Right, these are your forensics notes for death and decay. Make sure you're filling out the document as we go through the information. Right, so bodies, obviously, when found at a crime scene, offer a lot of different evidence. A couple of things that we can determine from a body is the cause of death. The cause of death is the reason for the reason the person died. For example, it could be disease, it could be physical injury, heart attack, blunt force trauma, anything like that. It is the reason the person died. That's different from the mechanism of death. The mechanism of death is describing the specific change in the body that brought on the death. So it's the physiological actions that happen in the person's body. For example, pulmonary arrest, heart stops beating, blood loss, right? So for example, their cause of death could be a shooting. Their mechanism of death could be blood loss. Manner of death. There are only a couple different manners of death. There's 5 of them. The 4 that we're going to talk about describe the way that someone died. So the 4 we're going to discuss are natural manner of death. So that would be they died of old age or a known disease. Accidental would be something that's not planned, not malicious. Homicidal, death of a person caused by another. So in the case of like a murder. Or undetermined. So there's no apparent manner at when first looked at the body. We may do an autopsy to determine the cause of death if it's undetermined, just based on preliminary observation. All right, these are the different people involved with death investigations. First, our forensic anthropologists. If there are skeletal remains, forensic anthropologists are going to use that skeletal anatomy to identify the remains. They can identify race, approximate age, height, as well as sex. There's also a medical examiner or a forensic pathologist. Those terms are kind of used interchangeably. Those are people who are medical doctors, so they are MDs, who perform autopsies and determine the cause and time of death. A coroner is a government-appointed official, and their role is to confirm and certify the death. So they deal with things like death certificates. They confirm that someone is actually dead, and they create those sort of government documents to certify that someone died. A lot of people use the term coroner in place of medical examiner, but they're very different. A coroner doesn't have any medical training, doesn't perform any autopsies, where a medical examiner does. A coroner is an elected official, or an appointed official in a government, whereas a medical examiner is someone who would have to apply for a job. All right, so let's talk a bit about autopsies. An autopsy is a highly specialized surgical procedure that dissects a corpse to determine the cause and manner of death. Autopsies are not always performed, but they will be performed in certain situations. For example, if the death is violent, an autopsy can be performed to determine the exact manner of death. If the death is unexplained or unexpected, then they may do an autopsy to determine the cause. Or if the death is very sudden, when the person was otherwise healthy, then they could also do an autopsy to determine the cause of death. So the procedure when performing an autopsy, the first thing they're going to do are external observations. They're going to take note of any tattoos, bruises, cuts, scars, gunshot wounds, anything visible from the external surface of the body. Then for the internal procedure, the first thing they will do is cut a Y incision. The Y incision goes from each shoulder down the chest and then vertically over the abdomen. Next, the organs are removed and examined. They're often weighed. They will examine like the heart and the lungs to determine if there's any sort of disease or trauma to them that could have caused the death. Once the body cavity is examined, then an incision is going to be created ear to ear around the back of the head in order to examine the brain. And finally, the body is closed up, so it's sutured together, cleaned off so that the body is clean and put back together. Medical examiners must determine the time of death. They're going to analyze 3 different factors if the time of death needs to be determined. So in the case of something nefarious, like a murder, they're going to have to figure out when the person died. They're going to look at 3 things: algor mortis, livor mortis, and rigor mortis. Let's talk about rigor mortis first. This is the one that people are most often aware of. Rigor mortis means death stiffness. The body is going to begin to stiffen 2 hours after death and it begins in the head and slowly works its way down the body. So it's not the entire body all at once. It's a progression beginning in the head and moving downward. As the cells start to dissolve and decay, the stiffness is going to disappear. After 36 hours, if the body's been dead for 36 hours, that rigor mortis is no longer present. The body's going to be limp again. Then there is something called livor mortis. Livor mortis means death color. So this has to do with coloration. That coloration is created by the blood settling in the victim's body, depending on how the body is positioned. So that blood is going to, follow gravity to the lowest point and is going to collect based on the positioning of the body after death. Pooled blood is going to release hemoglobin and turn purple 2 hours after death. From 2 to 8 hours, the color is going to disappear if the skin is pressed and released. So you can see in this top example here, right, something was pressing on it, and when released, that color disappears. Right? The color does not come back because the blood is no longer flowing. Same with down here. So that coloring can give us clues as to when the person has died. After 8 hours, the color is going to stay. So when pushed and released, that color is now like embedded into the tissue, so to speak, and will no longer dissipate. Then there is algor mortis. Algor mortis means death heat. So this is describing the body temperature. Body temperature is going to begin to drop after death, obviously, because the body is not alive to keep the body warm. Forensic scientists are going to insert a thermometer into the liver in order to measure the corpse temperature. It's usually put into the liver because the liver is a very dense organ in the center of the person's chest cavity. So it's the area that's going to retain heat the longest. So that's what we use to measure corpse temperature. Bodies are going to cool about 1.4 degrees per hour. After 12 hours, that slows to 0.7 degrees per hour until the body is the same temperature as the environment. So obviously, if the body's in a very hot conditions, the cooling is going to be much less than if it's in very cold conditions. Other things can cause a body to cool faster or slower. Things such as, is it in an area where it's being, insulated a little bit, preventing heat from escaping as fast? Or is it raining, for example, that could cause the heat to leave much faster? Postmortem interval is what describes the time since death. So postmortem interval begins when the person dies and can be measured to eventually trace back to the time of death. So in general, if the body feels warm and is limp, that means rigor mortis has not set in. The body has not cooled off too much yet. That means they were dead less than 3 hours. If the body still feels warm, but it is stiff, that rigor mortis has begun. That means they've been dead 3 to 8 hours. If the body feels cold and is stiff, that means that the heat is has dissipated enough to notice a visible change. And they're still stiff, so that rigor mortis is still present. That would be anywhere from 8 to 26 hours after death. And if the body is cold but is limp, that means the rigor mortis has now passed, so that person has been dead more than 36 hours. There are other things that can be examined to narrow down this time frame a little bit more, but these are kind of some general guidelines. After death, the decomposition process is going to begin. The level of decomposition gives clues about the circumstances surrounding their death. There's 5 different stages of decomposition: fresh, bloat, active decay, advanced decay, and dry. So in the fresh stage of decomposition, that's going to be 1 to 2 days after death. The pH is going to lower as the cells begin to break down. Liver, rigor, and algor mortis are going to occur. The body temperature is going to be dropping. The face is going to become discolored, and flies are going to begin showing up and laying eggs in any open areas of the body. Second stage is bloat. This is going to occur 2 to 5 days after death. The abdomen is going to swell with carbon dioxide. So as the bacteria is digesting as the bacteria are still in the intestines, they're releasing gas. That gas is going to build up and cause the body to swell. The face is also going to begin to swell. Veins are going to show red on the skin, and eventually they'll turn green and black in the later stages of bloat. You're going to see some marbling on the skin, so it's not just going to be a solid color. There'll be some discoloration and marbling. There may be some fluids that start to leak out, and there's going to be an obvious odor that is present. 5 to 10 days after death will be active decay. The corpse is going to continue to bloat with carbon dioxide as bacteria are present. The soft tissue is going to begin to liquefy as it decays. The skin is going to fall off. And there's going to be a lot more insect activity, both larvae and flies. At this point, there's going to be a very strong odor. Advanced decay will be 10 to 24 days after death. The body is going to begin to dry and preserve itself at this point. So a lot of that liquid is going to begin to evaporate. Most of the flesh will be gone. So most of the muscles and skin will be gone. There's going to be a reduction in odor as less tissue is there. And the insects are also, there's going to be less insects because there's less tissue available. A waxy layer will form on the remaining skin, and that's called an adipocere. It looks very similar to like what you would expect to see on like a mummified corpse or something like that. And then the dry stage of decomposition, this is 25 or more days after death. This is when there's really only bones that remain. It can take weeks or years to completely get to this dry stage, depending on the climate. Obviously, if it's a very like wet, rainy climate, this is going to take a lot longer. If it's in a place like a desert that's very dry, this is going to happen a little bit faster. At the end of the dry stage of decomposition, it's really just bones that are remaining. So it takes at least 25 days to get from a corpse to only skeletal remains. So adults have 206 bones. Babies have over 300 bones. The bones in a baby are going to fuse as they get older. So that's how we eventually get down to that 206. The number of bones and condition of the bones give clues about the person's. We can determine sex, race, their level of physical activity, their overall state of nutrition. We can also determine age and height as well. In generally speaking, and for the purposes of this course, when we are determining the sex of an individual, we'll be examining primarily the pelvis, but it can also be determined from the skull. When we are determining race, we're primarily going to be looking at the skull. When we are approximating age, we're going to be looking at the growth of long bones. Long bones are the humerus, femur, tibia, fibula, radius, and ulna. So as the name suggests, those longer straight bones that are in the body. And when we are approximating height, we will look at the length of long bones as well. For the purposes of this class, we'll be looking primarily at the humerus and femur when determining height. All right, so determining sex from a pelvis. Females generally have a wider subpubic angle, so that's this angle here at the bottom. On the female, it's going to be greater than 90 degrees. On a male, it's going to be less than 90 degrees. Females are going to have a very broad, what we describe as shovel-like ilium. The ilium is this part right here, right? You can see it's very wide, a little bit deeper, whereas this one's a little more narrow. And females are going to have a wider pelvic opening with less of the sacrum visible. The sacrum is what we think of as like part of the tailbone. So in a female, when we look from the top, the sacrum is going to be tilted backward and you have a large, rounder opening. In a male, the sacrum is going to be more visible when viewing from the top, and it's going to have more of a heart-shaped opening. Obviously, females have a wider pelvic opening because of childbirth. Males do not. If a female had a pelvis like a male, then the baby would hit the tailbone on the way out, and that would not work well. All right, when we are determining age, we can look at cranial sutures. Cranial sutures are flexible tissue that connects the skull as an infant and then eventually ossifies into adulthood. Ossifies means turns into bone. So the different sutures on the skull are going to close at different ages. The sagittal suture, which is this one down the center. In males, it's going to close when they're 26 or older. Females will be 29 or older. If the sagittal suture is open, that means the male is less than 32 and the female is less than 35 because it will close somewhere between those age ranges. So we can't pinpoint exactly. It's always a range, but That will give us clues as to how old the person is. If there is complete closure of the sagittal suture and the lambdoidal suture, which is in the back, and the coronal suture, which is here in the front, if all of those are closed, that means for a male that they're over the age of 35 and for a female that they're over the age of 50. If that coronal suture is open, that means that the individual is less than 18. All right, determining height. Determining height can be determined by long bones. Like I said before, long bones are things like the humerus, radius, tibia, and femur. Make sure you can identify where those bones are located in the future. We will always be measuring bones in centimeters. When we determine height, we'll be using formulas. If you are measuring in something other than centimeters, your answer will be incorrect. There are many different formulas based on race and gender of the individual. So there are different formulas for each bone, each race, and each gender. You will always be provided with that formula in class, and then you will just need to do the calculation. Race is very difficult to determine for most skeletal remains, but the skulls are generally more easily being able to be placed into one of three kind of general groups. So we can't like pinpoint exact race. We just kind of have three broad categories. First one is Caucasoid. Caucasoid includes European, Middle Eastern, and Indian descent. In a Caucasoid skull, we're looking for a long and narrow nasal aperture, oval eye orbits, narrow zygomatic arches, and narrow mandible, which is a jaw. A Negroid is going to include African, Aborigine, and Melanesian descent. They will have a wider nasal aperture, more square eye orbits, a pronounced zygomatic arch, which is like the cheekbone. And then Mongoloid includes Asian, Native American, and Polynesian descent. They will have a more rounded nasal aperture, rounded eye orbits, wide cheekbone arches or zygomatic arches, and a more pointed mandible. Here are three different examples of skulls. So we can see if we start with the Caucasoid one here, they have a more narrow nasal aperture compared to the Negroid and Mongoloid. Negroid has a wider nasal aperture. If we look at the zygomatic arches, which are up here, the ones on the Mongoloid are much flatter, whereas the ones on the Negroid are much more pronounced. If we look at the eye orbitals, the Caucasoid are kind of in between. Mongoloid are much rounder. Negroid are much more square. Caucasoid are somewhere in the middle. And then if we look at the jaw, the Mongoloid jaw is much more round. The Caucasoid one is more pointed. And then the Negroid one is more evident than the Mongoloid one, but not as pointed as the Caucasoid. All right, so those are your notes for death and decay. Please make sure you submit them on Canvas, and we will review the information more in class.